Welcome to the Personal Edge Fitness Podcast
with Garrett Williamson.
Health, wellness, exercise, nutrition, and a whole lot more. Got questions? Call us and leave a message at 251-278-EDGE or message us at Personal Edge Fitness on Facebook and Instagram, at Team PE on Twitter, or personaledgefitness.com.
Hey, welcome to the show. Appreciate you joining us today. You know, I'm talking all the time about telling people to just get up and move, if nothing else. But you know, the hottest concepts, the hottest things going right now in fitness, believe it or not, is not an app. It's not a little electronic device. And believe it or not, it's just reasons to get up and move. It's actually mobility. Now, I've talked a lot about this subject, but I decided that I would bring a professional in to shed some light on the importance of mobility as an emerging area in all levels of fitness. I sat down with Matt Broussard, doctor of physical therapy, who's the operations director with Results Physiotherapy, to shed some light on the subject. Matt, what would you say as far as lack of mobility? I don't want to put words in your mouth. Mm-hmm. I've got an idea of what I think y'all see the most of, but what would you say y'all deal with the most as far as when it comes to immobility issues, as far as injuries, areas of the body, and what have you?
Yeah, so we treat primarily, spine is the biggest thing that we see from a pathology standpoint.
Right.
So we see a lot of back pain, a lot of neck pain, a good bit of shoulder, hip, knee, but what we find in that is people with low back issues, for example, a whole lot of hip mobility issues, a whole lot of glute weakness issues, the same stuff that we were kind of talking through, that you were talking through earlier, is just because someone has issues in the lumbar spine, just because someone's got issues in the neck or shoulder,
right,
there are a whole bunch of areas that contribute to that. So we try to take a comprehensive look, top to bottom, at someone and see where are they moving, where are they not, where are they restricted, where are they weak, put that whole picture together and then get a plan there. We see a lot of hip mobility issues, and right back to the point you were making is, one, we don't move sideways anymore, and I'm a huge fan of consistent movement and variety of movement.
Right.
That's got to be a component to everybody's plan. And the other piece is, like when you go into lumbar pain and hip, once you reach a certain age, quote unquote, right? I ask a lot of my patients, when's the last time you jumped? When's the last time you sprinted?
Oh, awesome.
If you're not sprinting, the chances you're getting full hip extension are pretty minimal.
Right.
So what we do on a day-to-day is very hip forward, hip neutral at best.
Right.
And so
Gotcha.
we see a lot of limitations there where people they might try to get into some new things, but overall, hip mobility is a huge issue.
Sure.
Thoracic spine mobility is a huge issue.
Right.
So there's ankle mobility is another big issue that plays on a lot of different areas. So yeah, we run into the whole gamut of things, but I'm jumping ahead, but just back to the point where none of these things happen just because of what you said, passing on a calendar.
I didn't pay him to say that. Yeah. I promise you. I'm not kidding you. So, but this is what I talk about all the time. This is it's one of the reasons I started the show is the fact that this ridiculous idea that things are just going to happen to you. Now, I would think that the majority of people that come to see you have gone through an injury. They've had something, whether could be traumatic, it could be just but usually it's kind of a wake up call.
Mm-hmm.
I would guess. So, let's pick something like when they have a joint replacement. That's pretty big time. The potential for them to go back to regular activities. Would you say in most cases is that a large percentage, or is that most people aren't going to go back to normal activity after? That's a big question. It's a lot of areas, I'm sure.
Whether or not people go back to an activity is primarily their choice.
Okay.
Is what I would say.
Would you say that would be fear?
Yeah. So I think when it comes to mobility, when it comes to limitation, fear, and what we would call a fixed mindset, a mindset that I can't improve on something is by far the biggest limiting factor, right?
Okay.
And so, look, some of that comes from advice they've been given from several different people across the medical profession, friends, family.
Sure.
If you have a joint replacement, you shouldn't run. You shouldn't do these things.
Right.
I've seen plenty of people run on a joint replacement. I'm not advocating for it, not advocating against it.
I got you.
But I've seen people do it and be just fine.
Right.
The prevailing wisdom there is you're going to wear out your replacement. Well, what else? If you're going to sit around and do nothing, you're going to wear out a lot of other things.
Exactly. Well, of course, I'm going to have to agree with you on that. So, all right, you brought up something which I love hearing is the fact that somebody that had a joint replacement, there is let's put aside the idea that if you've got somebody that has other existing factors and what have you that could keep them from running even before they had the hip change. Yeah, I can understand that. But what you or hip or knee or whatever it is, what would you say is the difference between somebody that in everything being equal, They had a joint replacement, knee, hip, whichever example you want to use. What's the difference between that person going back to running and somebody not? What would you say is the difference there?
I don't know that we even have to use joint replacement, but I would say the biggest predictor of success going into any rehab, any new endeavor,
right,
is what's the person's attitude going into it, right? So if somebody comes to me and has an attitude that, yes, I can do this,
sure,
yes, I've got some support at home, right, like a sound structure around, I think that I can do it.
Sure,
that's easily the biggest predictor, and that ends up being the deciding factor on whether or not somebody does. Aside from some serious
no, I understand that. I mean,
right?
that obviously, and I'm going to remind y'all folks, what he's talking about is mindset, and we've spoken about that before. Let's take, if you don't mind, Matt, let's take a call. This is Tina from Mobile. You're on the show with Matt and Garrett on Personal Edge Fitness Show.
Hey, Matt and Garrett. Listen, thank you so much for talking about this, because my mother, as she gets older, in the last year or so, I've noticed that she's not balanced. She's losing her balance a lot. She's kind of wobbly. And two-part question, what should I do about it? And to get into a physical therapist, you have to call the doctor first.
Great. Matt, if you don't mind?
Yeah. Well, that the doctor first question gets to be a tad bit sensitive these days. So in the state of Alabama, we can do an evaluation on a patient without seeing a physician first. In order to initiate any treatment, we have to have a doctor at least sign off. And that can be a physician, a chiropractor, dentist,
right,
someone else that's not a PT. And the first question, I'm sorry, was what?
Talking about what to do as far as the joint imbalance, whatever.
So to go a little bit past what you were talking about earlier, Garrett, is, you mentioned a lot of hip stability, hip strength.
Sure.
From a PT perspective, balance is really kind of a three-component issue. It's a strength and mobility issue.
Right.
It's a vestibular system issue.
Right.
And it's partially a vision issue. So do you have the strength and stability, what we would call proprioception, your ability to maintain your awareness in space?
Sure.
Do you have a sound vestibular system, which is the one thing that we think maybe goes a little bit over time, but I still think that's more activity dependent than we give it credit for.
Sure.
And then most people are visually dependent on that for balance.
Right.
And so do you have good visual acuity?
Sure.
So from
if you don't mind, I'm going to jump in there on something what you're just saying, if you don't mind, Tina. This is something that's that we see a lot of, and that's balance issue. And that goes to, like I was telling the lady that came to see us yesterday, was talking about that. And I did a show on this, but what it's balance is in the brain. It starts in the brain. And it can, as Matt's saying, yes, it can have a lot to do with physical, but it's in the brain, and whether or not that cerebellum, that it controls that, it's a part of the brain that controls it. And think of it like when you're a toddler, and people are encouraging you to walk across the room. The neuropathways, the communication lines in that cerebellum are like a dirt road, and they're kind of developing. But as over time you start playing sports and getting more active, those neuropathways become a 4-lane highway, then an 8-lane superhighway. Well, as we stop those activities, strictly because our lifestyle changes, we stop those activities, we go back to that dirt road again. The thing is that just like a child, you can change it again. You can change it back. And that's what you're talking about as far as, one thing, vision, yes, but if the vision is good or corrected, then those things can be, those neuropathways can be built back up again. And we do it much like we do with a toddler. We start crawl, walk.
Sure.
Run.
Yeah, and what we do on a PT perspective is we evaluate all those things, we see where the deficits are, and then we make up, and we improve, we make up for whatever deficits you might have visually, or we work to improve those things. And that's the thing I think needs to be said is, no matter where you are, where you're starting from, is that everybody's got the potential for improvement.
Amen. I love that. Tina, thank you so much for your call. I appreciate that.
And thank you.
Actually,
thank you, Tina.
Let's keep going on that on that thought, which is one I talk about all the time. The one of the reasons I wanted to talk about this is that when you have decreased mobility, and I make this argument all the time that if I have somebody they're not missing a leg and a back and neuropathy issues, and even with those we can work it to the highest of the ability. But if it's just well, I've gotten older and I've lost my balance, well, let's get it back. And I mean, that's the way y'all would approach it, correct?
Yeah. Look, there's no limitation other than your willingness to do it.
Right.
And I think people get stuck in the, well, I haven't been doing it, so therefore I can't do it.
Right.
And that's just nothing but an excuse, honestly. I mean, it's just
of course, exactly.
So.
Well, and you were talking about something a minute ago. You were talking about the chain reaction problems. like somebody that's got I'm just making this up, somebody's got a problem in their knee, but actually it may be starting from in their middle back. Can you talk a little bit about that? So about imbalances and what have you, you know what I'm talking about?
Yeah. So we use the example of hip and low back, right? So when we do things like walk, so in order to take a normal step, we've got to get a certain amount of extension through our hip, so our hip has to go backwards whenever we take a step. If you don't have that mobility, our body tends to find a way to get things done.
Sure.
I'm going to continue to walk. I'm not just going to slow down and maintain perfect form, right?
Right.
So what we see then is as the hip can't move backwards, well, your back starts to pick up the extra motion to get us there. We start to lean and we start to turn and do other things to get where we need to get to.
Compensating.
Exactly.
Same thing. Exactly. That's the same thing we see in exercises. This is why, in fact, Olympic lifting got such a bad rap not too long after it came out, because people were watching people doing it and were trying to mimic what they were doing, and they were using lower back, doing a deadlift and trying to sling it all up their back and not using their legs. They started condemning the exercise, and you can correct me if I'm wrong. There's nothing wrong with Olympic lifting as long as it's done properly. And just what you're saying, in our normal movement, when we develop a weakness or a problem, then we're going to compensate somewhere else, which can exacerbate, can cause these problems, can cause back problems, can cause whatever. So
it's not just a lifter's problem, right? It's a movement problem.
Sure.
And so anybody who's got any limitations, maybe you can get by with those for years, and we'll get patients come in all the time and say, well, I don't know, nothing happened. It's just all of a sudden popped up out of nowhere.
Right.
And what it is these years and years of these mobility restrictions that then turn into these little bitty micro trauma related injuries. Right. And so we just go in there and assess these things and try to correct what we can, and then encourage people to
continue
move.
on afterwards.
Yeah. So now you've got the tools to move. Let's get in there and move.
People, once they finish physical therapy, that's when we try to get a hold of them, of course.
Sure.
But a lot of people, I feel, when they finish physical therapy, they feel, well, I'm fixed. Everything's done. I'm okay. And I think the potential injury, of course, goes up. How do y'all handle that?
Yeah, so we have probably not done a good enough job about bridging the gap between therapy and just general wellness.
So glad I'm having it on the show then.
So yeah, we've talked about that. But yeah, look, in general, one, we're not fixers, right? We facilitate healing. Our bodies do all of the healing themselves.
Sure.
All we do is kind of guide people along the way, encourage, medically get things where they need to be. But yeah, I think there's a lot of opportunity for people to continue and really like use it as it's a jumping off point, right? Like you're doing well, you're feeling good.
I appreciate you touching on a minute ago about how many problems you see that are related to fears. They're related. It starts in the mind. People being scared, and the argument that I make is that, and that deals with aging. That aging, when we think about that, we don't think of. We think of aging. I'm not talking about age spots and gray hair. I'm talking about, gosh, I when I was this age, I could do this, and when I'm now that I'm this age, I can't. Well, that's ability, and I think that there's 4 components of ability: fitness, nutrition, lifestyle, and the most important, and this is what I'm getting to, is mindset. And it's something you see a lot in your business about fears of actually continuing on. So that was kind of finishing that point a minute ago, but we were talking off air about something that we see a lot of, and I want Matt to kind of break this down for folks, and that's a particular area in the hip. Now, we're talking a lot about hips. You guys know I'm big on hips because incidence of the mortality jumped by, I'm looking at studies now, they almost double in certain age groups with the first hip fracture. Yep. And Matt's over here nodding his head and agreeing with me. So that's why we're talking so much about it. But hips encompass a lot of muscles in that area. You've got the whole gluteal group. I talk a lot about medial glutes and lateral movement there. But there's one that caused a lot of frustration in our clients, and we see it a lot. And I was talking to Matt off air about this. He sees it a lot, and that is I refer to it as the hip flexor, iliopsoas group, or whatever. And give us a little breakdown on that and some of the things you see, and expand on that if you don't mind.
Yeah, sure. So, when you mention hip flexor, tightness is normally what people come
if you would mind, kind of tell them what we're talking about.
Yeah. So your hip flexors are the muscles that work from your abdominals down to the front of your hip, which help bring your hip forward, bring your knee up like you'd be marching, that type of thing, right? So people will come in and say, I'm really tight in my hip flexors, potentially in my groin, the front of my hip, and specifically when we try to get things extended, try to get the hip extended, they'll complain of tightness across the front of the hip, right? And so people don't want to come in and stretch, and that's a really common thing. Well, I learned this hip flexor stretch online, or someone showed me this, and what we see is this tends to be potentially a multi-component problem, and oftentimes it's the compensation for another hip,
like we were talking about earlier.
issue, right?
Yeah.
So we tend to get these combinations of impairments that go together. So you'll get hip mobility, reduced extension, what we talked about, so the hip won't go back. Well, you'll get the glutes that you talked about are not firing real well. And and when all that happens, the hip flexor tends to tighten up to protect because we start to get some impingement. We get pains in the groin, things like that. So you end up with this collection of symptoms, which are tightness in the front of the hip, weakness in the back side and the glutes.
Right.
You'll tend to get a lot of lumbar pain with that. It doesn't always go with it, but oftentimes it will go with it because just things are not in balance, right?
Sure.
So when we attack something like that, you have to look at the entire picture of that again to go, like, if I just stretched out my hip flexor, I'm treating the second and sometimes even the third leg of the problem.
Exactly.
Right? So if I don't go in and address those other pieces, it's just going to continue to come back and come back and come back.
And this is something that I mean, we see this often, and it's something that happens, like you say, over time. You develop an advanced problem. This is why when we have a client says, "Oh, well, I got this pain over here, but it's no big deal. I'm able to get away with it out of problem." We try to address it right then and there because of what you're talking about, the chain reaction of those being associated with it. The other thing that we see with the hip flexors is back pain. And I have clients come in and say, something wrong with my back. I don't want to do this back machine, and that's what's causing it. And we do a simple just raising the knee up or doing a little bit of pressure on the knee. Just do a quick evaluation. One of my ATCs will do an evaluation, and bam, they feel it in the back. Yep. Tell them why that is.
So you mentioned the iliopsoas group, right? So iliopsoas, or your psoas major iliacus, that whole group, that becomes your iliopsoas. It attaches in your lumbar spine, so it attaches from the segments from L1 down to L4, then goes into the front of your hip. So anytime you pull on it, if you're going to resist at the hip, you're going to pull on the back, and you're going to pull on the hip at the same time. Right. So it pulls your back into an extended position, so an arch back position. And so if you've got any sensitivity to that movement, anytime you fire the hip, you're going to get some potential irritation in there too, right? So,
and that's what we see a lot. That's what's confusing. And what Matt was saying is he's saying it attaches right around L4, L5. He's talking about the spine. He's talking about your back. So that's where it attaches, and then it connects basically. Goes through the body and connects to the front of the hip. Yep. So when we address that, we are actually having people do something with their knee, and they're looking at us going, and that's my back that hurts. My back that hurts. Not really. It's really that iliopsoas causing it. It can be very, very confusing. What have you? So
and so it's counterintuitive to think something in the front of my hip is always connected all the way to the back, but that's where the detailed anatomy stuff comes in, and if you really understand how these things are all connected, and psoas is one of those things. I mean, you could look at the connections from a lot further up and down than that. It's pretty wild how far up some of the fascial connections go. But anyway, so it's a really common thing. It's something we treat a good bit. But again, I think it's oftentimes a secondary deficit that if that's the only thing we're looking at, you're really going to be missing the boat on a lot of things.
Right. Yeah. So. Well, and I really wanted Matt to talk a lot about that, because if you have a lower back pain, you really want to know what's going on there. A lot of people have that, and they'll I have a lot of people do this. I stretch and everything's fine. Or the biggest one we get is I get up in the morning, it hurts, but I get moving and it goes away, so everything's okay. No, everything's not okay. Yeah. We've got circulation going on, it's warming up, and you want to make sure that if you're doing things to compensate for that, because like a lot of people tell us about, as soon as they have a back problem, they want to work abs a lot. Got a lot of other things going on, and the hip's just one of them. Lower back and all that stuff also. So.
Well, I think that's, you hear someone say that, once I get moving, I feel better. Like, okay. Your body often tells you what it needs, and exactly. I think we just don't listen often enough. It's part of the problem. Yeah.
Too true. I want to address one more muscle real quick. Hamstring strength. See a lot of problems with that?
So I think the issue we see with hamstring strength, in my mind, right? So it's interesting, and different practitioners will kind of classify things different ways, right? Sure. So if any muscle is on too often, it can't inherently be as strong as it needs to, right? And so what I see the way I classify it is I see hamstrings be on all the time when glutes are not. Okay. And those things do some similar motions, right? So if this muscle is on all the time and doesn't have its chance to turn on and turn off appropriately, it's never going to be functioning at its optimum level. Right. So if hamstrings are just constantly on because your glutes are not, or because your hip flexors are on all the time, or whatever it might be, then they're going to fatigue quicker.
Right.
So then it's going to show up as weakness.
Okay.
So whether or not it's truly weak from a 1 rep max kind of standpoint, functionally it gets weaker. It doesn't operate as it should.
We see it as being probably the largest ignored muscle in the body, and that's the thing that concerns us. Real quick, tell us a little bit about results, how your approach to treatment, what you guys do.
Yeah, so Results is we're a manual therapy-based company, which just means we're going to put hands on patients and using joint manipulation, mobilization, soft tissue, trigger point dry needling, any of these kind of hands-on techniques to work to get people's pain reduced, get them, and then encourage movement again, right? So we see every patient that comes in sees a PT at every visit, and typically the same PT at every visit, which is pretty unique. That's not really the model across the board, but we value that, and we think that it's integral to somebody's care. So
absolutely.
So with that, we train our PTs up really, really aggressively. We we have nothing to stand on but the fact that we do a good job at PT. So,
well, you're also talking about the way you approach the therapy. It's almost like an osteopathic approach about the body kind of healing itself.
Yeah. So I mean, that's my training in particular. We have a very patient-centric. There's some mechanics, but a very pain science kind of centered to understand how pain really works in the body.
Right.
So I mean, we're all big believers that none of us are fixers. We're facilitators. We help people heal themselves and try to become the best versions of themselves.
Dr. Broussard, we sure appreciate your time, and thank you so much for shedding some light on this subject that really we all ought to dive into a little more. Really appreciate you joining me today. Remember, please like and subscribe to the show. And also, we're always looking for new ways to help you out. If you got an idea or something you want to hear, a question about health, fitness, or wellness, be sure to give us a call at 251-341-0927 and let us know how we can help you find your level of wellness.
Thanks for listening to the Personal Edge Fitness Podcast with Garrett Williamson. Subscribe now and be a part of the show by calling 251-278-EDGE or message us on Facebook and Instagram at Personal Edge Fitness or at Team PE on Twitter, and visit us at personaledgefitness.com.